You mentioned calcium, and you mentioned that the laser is really helpful in calcium cases. Tell me about your experience in that situation. When would you decide to use, say, a rotational or an orbital versus a laser?
Yeah, I think that's an excellent question. I mean, orbital atherectomy and rotational atherectomy were purpose designed for treating calcified coronary lesions, and I think they're very effective in that. I think those devices have some limitations, one being that they require the use of a specialized wire.
Right.
That is actually, I think, one great advantage of laser atherectomy is you can advance it over any 014 wire and don't have to lose wire position if you decide to use the laser. But laser atherectomy, especially if you turn it up to a high rate, then it can modify the calcium. It also, because the mechanism the laser works by is creating a vapor bubble that expands, that bubble can modify calcium, and especially calcium that's deeper in the artery, for example, and preventing expansion. And in the last few years, we've actually learned that even prior to the formation of that vapor bubble, there's a sonic pressure wave that occurs when the laser fires.
Right.
And that pressure wave is essentially a shock wave that can expand.
Right, it's almost a resurgence of this technology, isn't it, in these really quite challenging and complex cases. So that's absolutely fascinating to hear about the use in calcium and ISR.